Welcome once again to Church Alive, and this is your host and president of Church Alive Development Corporation and the proud pastor of Church Alive Community Church. And once again, we're here to bring you a holistic approach to the gospel, and that is to bring you information, resources, and services that will improve the lifestyle of the body of Christ, our friends, our neighbors, and certainly our loved ones. We have a special program, and it's called Ask Dr. Tommy O. And many of you have seen him on our television program on Saturdays, but now we've moved them just for this special program for Mother's Day to Sunday. And we're going to give you a chance to call in and ask Dr. Tommy O. The subject this evening will be diabetes. Diabetes has turned out to be a very serious problem in our community, especially the community of the Bronx. It's gotten to an epidemic situation. Not only, many times we thought it was with elderly people or people who were subject to very acute bad habits, but it's now getting into our children. And so we have felt, and Dr. Tommy O and agreed that this would be important enough a program to bring it to you this day, and especially in consideration of our mothers. And we want our mothers to be healthy. We want them to live a long time, and mothers and fathers. And I had a tragic situation many years ago to lose my father as a result of sugar diabetes. And the reason was, it was lack of knowledge at that time. And they felt that the only way that you could stop the spread of diabetes was to amputate. And they amputated his toes, then his foot, all the way up to his hip. And then it all of a sudden it flared up in his other foot, and it began to do the same thing, until eventually, out of the pain, and the body just caved in, and he left this world. But I know that through the information that I have received from Dr. Tommy O, that it could have been prevented. Certainly, his life could have been extended. But we thank God anyway, because God does all things well, and He's in heaven now, and of course, his testimony is an opportunity to shock you into a realization that you have to do something about diabetes. But before we introduce Dr. Tommy O, I would like to also wish all of the mothers happy Mother's Day, and we have a special song coming up that will be a blessing to all the mothers. As a tribute to mothers, the Lord's Prayer, sung by my daughter, Melissa Bartholomew Burkett. And so that's coming up. But also we would like to give all of you an opportunity to get a souvenir hat, a hat that you're going to see all over the Bronx and eventually all over the city of New York, and it's called Stay Alive with Church Alive Cap. And you're going to see people wearing this cap, and we want you to have this souvenir cap to wear it through the summer. For those who are part of our Church Alive family, and we have thousands of people, since we've been on television all the way back to 1987, we have won the Beta Award 6 times for excellence in education and health programs. And we would like you, those who are watching, to have this souvenir cap and wear it proudly. Stay alive with Church Alive. And you'll see the cap coming up on the screen, and that's the cap that you'll be wearing. And you can't buy it in the stores. You can't buy it in Macy's or Gimbel's or wherever. You can only get it by going to our website and churchalive.org, and you can then get that cap and be like many others. You'll be one of the first to be wearing it. Already over 2 dozen of these caps have gone, and we know that we'd like you and you out there to have that souvenir cap in honor of this television program, Stay Alive with Church Alive. And to all the mothers who call in to speak to Dr. Tommy O, we're going to give you a piece of history, the Journal of Negro History. This is a collector's item, a very valuable book that was buried over 30 years, and we discovered it in a warehouse, and these books are brand new. And each volume, you can't buy it anywhere. The only other place you can get it is in the Schomburg Library. We want every mother, every female that calls in to speak to Dr. Tommy O tonight to get this book. Okay, we're going to move right on. Welcome, Dr. Tommy O.
Thank you.
We can't say welcome because you're a natural here at Church Alive. This is basically your program, Ask Dr. Tommy O. But we also have a guest with us, and that is Miss Grant. Ms. Grant is a medical assistant that works as a team member with you, and she's also a health educator. Ms. Grant, welcome to Church Alive.
Thank you.
Okay, Dr. Tommy O, we're going to go right into the problem, the issue that's at hand, and that is what is diabetes?
Okay. Diabetes is what we call uncontrolled blood sugar. I'll just give you a little statistics because we're talking about at epidemic levels. I just went on to New York City Department of Health website just to get some statistics. Statistics are as follows. 1 in every 12 people have diabetes. It is estimated that about 250,000 people, that's what they're stating, just in New York City, but it's much greater than that. Okay. They said that over the past 8 years that the diagnoses have doubled. That's pretty significant, within 8 years. And that's contributed to lifestyle, lack of education, as well as obesity. That has increased. Right.
Now, when we talk about diabetes, in the studies defined, there are different levels, and there are those readings that exceed 140, and then the random blood sugar readings. Can you tell us what that's all about?
Okay, well, we're talking about defining what diabetes is. Like I just stated, that diabetes is defined as uncontrolled blood sugar or blood sugar above the normal range. First, let me define what the normal range is. The normal range is 60 to 110. Therefore, anything that's greater than 110 would be diabetes, but first we would have to break it down and how we test. What we do is we do a fasting, a true 12-hour fasting blood sugar reading. That's where a patient does not eat for 12 hours. I like to go for 14 hours, and then I take a blood sugar check. If their reading is 140 or greater, that would be a definition or defining diabetes. We also do what's called a glucose tolerance test, and specifically, you can either do a 1 hour or 3 hour. I would prefer to do a 3-hour glucose tolerance test. This is where a patient would drink what we call a glucola. This is a very high carbohydrate, really caloric dense drink. And we would take blood sugar readings or finger stick every, the first hour, the second hour, and then the third hour. In order to have a positive or diagnosis of diabetes, you must have 2 positive readings out of 3, and that is the definition of diabetes.
Okay. Now, there are types of diabetes. There's type 1 and there's also type 2. Can you give us the significance between the 2 of them?
Okay. Type 1 diabetes is what we call insulin-dependent diabetes. What that means is that the body requires exogenous, meaning insulin outside the body being injected into the body to help drive the blood sugar into the tissues. Out of all the patients that are diagnosed with diabetes, approximately 5 to 10% of all diabetics are type 1. Usually you are born with type 1, but this is not absolute, and I'll go into that a little bit further in more detail a little later.
Now, when you mention born with it, then you're mentioning the hereditary now.
That's correct. Talking about something that's being passed down from mom and dad, genetics, lineage being passed down from generation to generation.
Right. So, in other words, it's quite possible that, like in my situation, my father had diabetes. There's a good chance that, you know, a brother or sister mine could have it, and it's a possibility that eventually one of family member or more than one can have it. Am I correct?
That's correct.
So that means it's important for people to be tested. Okay. Yes. Now, type 2.
Type 2 diabetes. This is, out of all the diabetic patients that are diagnosed, would be approximately 85 to 90%, or from 90 to 95%, depending on your books. But this is based on, again, genetics, as well as the body habitus. Type 2 diabetes is directly related to your weight. Someone who's obese or morbid obese is at high risk of developing type 2 diabetes.
Now, if a person comes into the office to a diabetes test, okay, you look at a number of factors. Am I correct? What are some of those factors?
Well, we look at factors that increase risk. That's what we call modifiable and non-modifiable risk factors. And this applies throughout life and within